7-Eleven.
It's time for News Extra at 7:48, brought to you today by Intralinks. Here's Kevin Mooney.
Thank you, Dennis. Good morning, everyone. Very pleased today to have some folks from the Panhandle Mental Health Center here to discuss things regarding mental health and how you can react to this mass shooting and what you say to your kids and just all those type of things. We have Pamela Richardson here. She's the clinical director at Panhandle Mental Health Center. Phil Darley is the youth services director there. So Pamela's going to start, and we're just going to initially start with what you can say to your children regarding this shooting and hopefully comfort them. I understand the schools have done a reasonably good job, right?
I think the schools have done a good job. They've been sending out letters to the parents. They have things posted on the website through Scottsbluff Public Schools. And they've talked about some of the things that are done in our local school systems for the training, for the safety measures that have been taken. I think parents can continue to reassure children in their homes about similar types of things. We want to be careful not to try to make promises that we can't follow through on or that aren't true. Kids will see right through that and know if we're not being honest about things. But being able to tell them about things that we are doing to help them be safe and things that we can do at home to help kids be safe, partly through being prepared as well. If we have safety prepared plans for children, what happens if there is an emergency, and talking that through with kids. Depending on the age group, kids can have really different reactions, some of which may be really fearful or clingy. So they may need a little bit extra reassurance and comforting. I think being able to listen to kids is real important. Listen to their questions, respond honestly, and go ahead and share some of your feelings when you feel sad or heartbroken or fearful as well. But realizing that children will gauge their reactions towards their parents and adults as well. Keeping things in a routine to help them feel settled can be helpful, as well as being able to have time to connect with them. So I think really being able to listen to what they're asking about, connecting with them, offering about things that are being done for safety, and limiting the media exposure as appropriate too.
Yeah, okay. Phil, let's talk about simply behavioral health services for youth around this region. And the situation has kind of been in flux here for a few years. You guys, the state went to kind of a private situation. They're now back to going to the government-funded behavioral health services, and I guess it's working a little better there. But let's discuss partnerships and revenue you guys have and what you can do to help children out that are mentally ill and even people that have been identified as mentally ill.
Well, I think a key thing to look at is that funding is always an issue anywhere you go. And with children's behavioral health or behavioral health in general, access to funding to meet those needs is always tough. What's really important to look at is here in Region 1, the 11 counties that we work with, there's a lot of partnership going on, a lot of great momentum that's taken place, a lot of collaboration between agencies, organizations, institutions, and from what I understand, compared to other areas of the state, we're actually setting a model. We've got people are willing to share clients, so to speak, to the point of making sure that they get the services that they need, making sure they have access to the resources. There's a lot of really positive things going on with both youth and adult behavioral health services right now.
Okay, and these resources, how do you work with? I guess the toughest thing is to identify children or others that may have some problems, and especially with this last incident, it's not just people that are say just quiet and not all that social, because that doesn't necessarily mean they're mentally ill. They're right.
Right. I'm glad you bring that point up, because I think it is real important that we be really careful not to begin to stereotype. That can just add to contributing to the myths about mental health and behavioral health problems and the stigma that we work so hard to, provide more education to the community about. Our schools have got great programs with anti-bullying and trying to teach tolerance and acceptance and working with everyone, getting help when help is needed, but not separating out people who may be different and have problems. And unfortunately, when incidents like this happen in the news, I think we see more of that, where that stigma and those myths and things that simply aren't true about the connection between mental health problems and violence begin to get perpetuated again, add to the fear, can add to the bullying, and some things that are very unfair to people.
All right. The schools, I know Superintendent Miles has said more needs to be done for the mentally ill, more funding, and so forth. And there was a therapist that indicated yesterday out of Lincoln that the kids need to kind of be aware of their surroundings. And if they hear something they think is dangerous, they need to let people know, right?
Yes.
You know, and make sure that folks know about that.
I think that awareness, the ability of children to know who the safe people are to go to, who do they tell when they're at school, who can they go tell in their neighborhoods if things don't look right, if they don't feel right around them. So that's part of the preparing and planning that each family can do, that we can do to help the children. And it's good advice for us as adults as well to always be aware of those surroundings and to have a little bit of a plan ahead about what would we do, where would we go if we needed to.
All right. And folks should not be afraid if they have some problems, if somebody has some problems, to come talk to you guys. Am I right?
That's right. Yeah, recovery is a real important part of the treatment, both for substance abuse, where we hear more commonly about the term recovery, but also recovery and mental health wellness, and being able to help people move through stages of treatment and reach recovery and wellness for their behavioral health problems.
All right. Real quick to Phil, the 1184 meetings that you were talking about, this is really kind of picking up a little bit between the law enforcement and the mental health people and others, right? In the
That's
county?
correct. 1184s had the opportunity to see a couple of in action up in Dawes County, and down here in Scottsbluff County as well, and in other surrounding counties in the region. The 1184 is an opportunity for different players to come together that work with youth and adults, whether it's law enforcement, juvenile services, the county attorney's office, clinicians, agencies that support youth and adults, and really try to help them provide some guidance and direction to make referrals and resources, whether their mental health diagnosis is involved or not. And I know, talking with staff down here at the 1184 in Scottsbluff County, they're really excited about what's happening, and referrals should come into agencies to allow those resources to be accessed.
Okay. If somebody wants to contact the Panhandle Mental Health Center, the number is 635-3171, 635-3171, and you can talk to the folks of the Panhandle Mental Health Center. All right, very good. Thank you very much for the information. Appreciate it.
Thank you.